The Periwinkle Foundation supports over 4,000 children and families affected by childhood cancer with camps as well as arts and survivor programs. Here to tell us more is Community Programs Manager Erin Overhouse. Erin, great to see you. Thanks for being here.
Thank you for having me.
So as I mentioned, the Periwinkle Foundation supports over 4,000 children, teens, families that are affected by cancer or other life-threatening illnesses. Talk a little bit about the programs that you guys do offer.
So the Periwinkle Foundation was established in 1983. We've been around for 31 years, and we provide a series of camps throughout the year for patients really from the start of their diagnosis into young adulthood as long-term survivors. In addition to our camp series, we also partner with Texas Children's in the Cancer and Hematology Centers and work with their Arts and Medicine program to provide all kinds of art activities in the clinic and also in the inpatient center and the bone marrow transplant unit.
It seems like it makes all the sense in the world, and that's fantastic that you guys do that, just because that's a tough time to deal with in life. So to have that outlet, whether it's a camp or an art initiative, that's great that you guys are doing that. Talk a little bit about the camps. When you say camp, do they go somewhere, or do you guys come to the hospital?
Both, actually. So we take children out to camp for an overnight camp stay. We have a week-long camp as well as weekend camps, and then we also bring camp to the hospital, to the clinic environment. When children are in treatment and they're at the hospital day in and day out, it's really taxing, not only on them, but on their families. And so anything we can do to transform the treatment environment through the arts and through camping activities. I
mean, it makes sense. I guess I didn't think about that. I was thinking just for the person going through it, but of course it would affect the entire family. So that's neat that you guys have programs that are all inclusive.
It does. It's very important to us not only to focus on the patient, but on the sibling and on the parents, and a lot of times even grandparents. Any kind of caregiver is greatly affected by a diagnosis.
No, again, that makes sense. So we talked about the camps. Arts is another huge program that you guys offer, and you mentioned that briefly. Talk a little bit more about that.
It is. So in 2001, we began our partnership with the Arts and Medicine program at the Cancer and Hematology Centers, and this year we actually have expanded our partnership to increase our funding and our support around the program, and really ultimately just to provide more programs and to work with even more children and even more families. We work 365 days a year. We bring all kinds of local artists with all different mediums of art into the treatment center and just change it.
That's great. Now, talk about, is Making a Mark, is that kind of what you were describing right there?
Making a Mark is part of our Arts and Medicine program. It is a traveling exhibit. Each year we have approximately 350 pieces of original artwork done by patients and siblings from treatment centers all over the world. And every September, in recognition of Childhood Cancer Awareness Month, we have them all on exhibit at Texas Children's Hospital, and then from there they travel to venues throughout the city of Houston and also sometimes even internationally. And we exhibit at venues such as Hobby Airport, Intercontinental Airport, local businesses, City Hall, really anywhere we can just share our children's art.
That's great. And I think that, again, I go back to, that's a very difficult time for somebody going through this. And you'd mentioned you work at the Texas Children's Hospital and Hematology Center. So in addition to cancer, what are some of the other life-threatening illnesses that people may have?
So the way that the clinic is structured, they treat not only cancer, but also any kind of blood disorders. Oftentimes those diseases have very similar treatment protocols as cancer. And then we also work with teenagers from other services at Texas Children's Hospital with cardiology disease, renal disease, really a variety of services.
Well, Erin, it's great to hear about all the wonderful things that the Periwinkle Foundation is doing, especially for a very trying time in people's lives. So thanks for what you do. Best of luck. It's been great talking with you today.
Thank you.
Sure.
Thank you for having me.
Sure. To learn more about the Periwinkle Foundation and other Newsmaker segments, visit ComcastNewsmakers.com. I'm Michael Bybee.